and currently I am working at Beniwal Hospital, Jaipur, as additional director in intervention cardiology. Today we are going to discuss about latest update about the hypertension. As you know that hypertension is a very common disease, but it is the most ignored disease also. So, as per WHO, nearly 63% of the total deaths in India are due to non-communicable disease, of which 27% are attributed to the cardiovascular disease, which affects 45% of people in the age of 40 to 69 age group. Raised blood pressure is amongst the most important risk factor for the cardiovascular deaths. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, prevalence has also gone up over 30 years to 38% in males and 32% in women, from 29% and 28% respectively. Despite that, nearly half of people, or 51% of the men and 41% of the women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension has released the ISHS 2020 Global Hypertension Practice Guideline. The inclusion of optimal and essential treatment paradigms attempt to address the issue that in resource poor setting. Optimal care refers to evidence-based standard of care, and whereas essential standard refer to the minimum standard of care to allow specification of essential standard of care for low resource settings. The AHA-ACC has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adults means no ASCVD or 10-year CVD risk is less than 10%. With stage 1 hypertension means blood pressure between 130 to 139 systolic and 80 to 89 diastolic. Management starts with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting a pharmacological therapy. Acute respiratory distress syndrome is a potentially fatal condition involving the lung damage, and experts often associate it with the severe COVID-19 in current era. A recent study which appeared in the Journal of the American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to the 110 to less than 130 milligram Hg range substantially reduce the cardiovascular adverse events in the STEP randomized trial, affirming the sprint finding of foreign older Chinese population. Among some 8,500 patients aged 60 to 80 in China, the intensive target trimmed 26% of the composite cardiovascular risk. Finding from now a second major trial supporting a lower target could unite the guidelines, which even among us, US professional societies range from thresholds of 130 to 150 milligram Hg. With regards to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European Guideline on the Management of Arterial Hypertension recommends that the diagnosis of the hypertension should not only be dependent on the office BP measurement, but also on out-of-office measurement such as ABPM, means ambulatory BP monitoring, or home blood pressure monitoring, means HBPM. 24 hours and nighttime BP measurements are associated with a greater risk of mortality and composites of cardiovascular outcome. Thus, they may be considered as the most relevant measurement for estimating cardiovascular risk. For every 20/10 mmHg increment of BP measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2014 European guidelines equally recommend 5 classes of antihypertensive drugs considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to the therapy and BP control. Therefore, the 2018 European guidelines recommend, especially in the context of the lower BP targets, to start antihypertensive therapy with an ideal dual fixed combination of the AC-limited ARB plus CCB or diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the direction of the non-carcinogen NMDA, which can be found in candesartan, irbesartan, losartan, olmesartan, or valsartan. MDMA has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in humans. If 1 lakh patients would have received MDMA containing valsartan from Hawaii, every day for 6 years in the highest dose, it could result in 22 additional liver cancer over the lifetime of this patient. The presence of the NDMA in these drugs could lead to additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. Was certain recall accompanied by significant increase in the rate of emergency department visits. The HYGIA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was supposed to be the significant reduction in the endpoints, means death. The Hygia chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerts its favorable cardiovascular risk reductions. The largest study included a total of 19,084 hypertensive patients during an average follow-up of 6.3 years. 1,752 participants experienced the primary cardiovascular outcome. An ambulatory BP measurement was performed for 48 hours to collect data on high BP of differed during sleep. The relative risk reduction for cardiovascular events was significantly improved for nighttime treatment when compared with the awakening treatment. Thank you very much, and that's was my talk for today.